So, again, we do this at a very fraught time. Obviously, the issue of racial and social justice roils the nation. And this has always been a pertinent concern with regard to the food supply and dietary patterns. So it's a really perfect time, I think, to address the confluence of those. So we want to address what the main overlapping concerns are related to racial, social inequities and the quality of nutrition, how variation in dietary quality relates to chronic disease and how that translates into disparities in epidemiology. Want to look at the responses of the medical system and how those pertain, and then land on some solutions. And I couldn't think of a better group of panelists to help us cover this from both the demand side, the supply side, the national perspective, the global perspective, the clinical, and the cultural. So again, Mary, Mark, Kim, just delighted to be with you. And Kim, if you don't mind, we'll start with you. The view from altitude about chronic disease, we tend to talk a lot about the chronic disease burden in the United States at large, in modern countries at all, but just some comment here on the differential burdens that pertain to different populations, and in particular with regard to race.
And you know me, I've been talking about this for decades now, that we live in a pandemic of heart disease, so all of a sudden we're in a pandemic of COVID. And it just so happens that the overlap is incredible between the two. So yeah, when I put those up there, is it CBD or is it COVID, which has CBD embedded in it, interestingly enough. The obesity challenge that we have in this country is absolutely increasing. And it has to do with the diet, and that's been so well documented. I don't have to talk specifically about it. I do want to mention that any dietary stuff that you do that restricts calories will help, but you want to make sure that it's long lasting and that it's cardiac helpful. So we have data from Adventist Health that says that if you are doing a plant-based diet, you are going to be the only group that is not overweight. It has the least hypertension, the least diabetes. And in terms of cardiovascular mortality, forgetting about COVID for a moment, particularly for men, you get a 20 to 30% reduction, and even all-cause mortality is reduced. So my favorite is blood pressure. I spent a lot of time helping to write those guidelines and to point out that we have so much data on plant-based nutrition that if people will clean up their diet, their blood pressure will improve. But we have this in the African-American community. We have so much hypertension, obesity, type 2 diabetes, along with the high cholesterol, that it gives us the predisposition for not just coronary heart disease death, which has been #1 since the last epidemic or pandemic in 1918, the #1 killer of Americans. But it's more of a killer of African Americans than anyone else. And if we were to just pay attention to the principles on this slide, we could avoid these diseases and avoid this risk. You can actually make all of the risk factors that make people die of either of our pandemics, either heart disease or COVID, dramatically improve with a plant-based intervention. We had good adherence, and the bottom line of this is that of the 21% increase in cardiovascular events that we have in the United States with the African-American population, we were able to eliminate by our risk calculator 19% of that. So I would say that we're going to talk, and as I yield the screen, we're going to talk about all of the social determinants, and I'm happy to go into it because I grew up with it.
Right.
But it really isn't just about if we could fix one thing, I would still have to say it's education. But if I could fix two things, right along with it, it would be nutrition. If we get to the nutrition roots of cardiovascular disease, we're going to get our people out of both pandemics.
We find that education that affects nutrition start post-secondary school. So our education system up to secondary school is not giving enough dosage to change behavior in nutrition. So if people that are going to know what to take and take because of health purposes started college, we have again removed all that group together. So again, when we put them in environment, as we all know, I don't want to sing to the choir, policy is one of the #1 thing that affects a huge number of people. The next to the policy is environment. If food is there, if food is accessible, if healthy foods are there, then it's easier, even it's by default, to eat the right food. This same group of people we are talking about, racial disparity and socioeconomic disparity, they find themselves in a place where they cannot get healthy food. And if they get it, it's more expensive than their colleagues in the suburbans.
We're talking about equity in the food supply. We kind of have differential food supplies for different segments of the population. Just a quick perspective from you on the importance of that and the factors underlying it.
We're getting to the core of the issue, and that is access, and access is about income. People with more money tend to eat better, and people with less money tend to eat worse. So if we can improve access, we can improve education and nutrition. Most people know what a good diet is. That doesn't mean that they're able to have it. And access is a policy issue. These are policy issues we're talking about. They're not only nutrition issues. We know the nutrition, or we at least are headed in the right direction toward knowing the nutrition, but we're unable to really help people to have the kind of diets that we know will prolong lives. So that's issue #1. I think an issue that's often overlooked is, now I have a dog issue too, actually. Hello there. I think an issue that's often overlooked is general wealth. And we're not just talking about income, but we're talking about how wealth has been built and accumulated in the United States. And that was based on the largest land giveaway in our history, which happened around the time of the Civil War in the Homestead Act. And that giveaway of land, which was the foundation of wealth for many white Americans, excluded African Americans, excluded former enslaved people. And that's a problem that has yet to be addressed. So I don't mean that people can't eat better until there's land reform, until there are reparations, but I do mean there are some very fundamental issues here that are not exactly epidemiological. They're not exactly health-based. They're really policy-based and overall society-based. And if we're going to talk about what we need to do to fix those problems, I hope I don't sound like I think we have a fundamental disagreement here, because I don't think we do. If we're going to talk about what we have to do to address those problems, we have to have responsible government, and that is a big part of this issue.
This issue of racial disparities, is this uniquely a U.S. problem? Are there sort of inter-country disparities too? Food insecurity, is that something that we should be thinking of globally? Are the factors that are contributing to it different in other parts of the world than here in the U.S.? Just some perspective on this.
Food insecurity, of course, it's a global thing. Even here in Lubbock, I'm in West Texas. My study with food insecurity among African American is more of not hunger, but eating probably the food, the South, the fried food, whether it's vegetables, whether it's the okra, everything is not just the meat, everything is fried. And they are conditioned by the environment. That is what is available. And within a mile, there is no grocery store. Where they live, within 5 minutes, I have about 3-4 full-fledged grocery store. I go to Ethiopia and I find food insecure. I go to rural Texas with a Hispanic population, and there it's more of the monotonous. Their culture is very strong, so they keep to their diet. But what they tell me is that when we don't have enough, we dilute it. We put more water to the soup. We eat soupy food. And so we find, then I go to Africa, and they don't make soupy, they don't eat more of the high energy, but they go hungry. They actually divide the food and sleep without food. It doesn't matter how you look at it. While the high energy diet, dense diet, nutrient empty diet with the African American in East Labak is going to lead to heart diseases when the diluted soup is going to bring malnutrition. Both will add in the same place. When the disease comes, they will be the first one to fall because their immune system and all that depends with it.
Kim, connect the dots if you would. So you talked about the importance of dietary pattern, the adverse impact related to racial disparities and differences in prevailing dietary patterns. We often think globally about food insecurity as hunger, malnutrition, starvation. But of course, here in the U.S., food insecurity often and somewhat paradoxically almost contributes to obesity and then the pathway of chronic disease. How much food insecurity do you see? How big a factor is it in people making poor dietary choices?
So this is an issue that sort of piles up on itself, David. That is, you have these little grocery stores that are barely making, a reasonable business, and they feed people what they want instead of the fresh fruits and vegetables. And so people will say, oh, we have food deserts. You can't find the fresh fruits and vegetables. Well, the mom and pop stores that are in the neighborhoods would actually carry them if people were buying them. So going back and talking about education is really important. And there's a way in which my whole presentation saying how badly we eat, to paraphrase the great philosopher Marie Antoinette, let them eat plants. We have to do more than that. We can't just present the data. We have to find ways of getting into our institutions, the barbershops, the churches, get where people are, and have people understand what we're talking about from an educational point of view and make better choices. And then the businesses will follow. But ongoing, we have got to make better choices. Now, part of that is the pricing. And the pricing has to do with congressional subsidies. And I know we've got one congressman, Earl Blumenauer from Oregon, who's a champion of this, saying that if Congress subsidizes pastries and unhealthy foods and makes them so inexpensive that's what people, they like it anyway because it tastes good, makes you feel good, raises your dopamine level, and you're paying less for it. It becomes a trap that's hard to get out of. Yeah. So all we can do is continue to try to do programs like you're doing right now and educate people about what they should be eating, not what their ancestors were eating. That whole idea of eating low on the hog because it was the things that the slave masters would throw out. And then we found a way to make this more palatable.
I think that there's an issue that often isn't discussed, and that is that we eat what's available. And Kim obviously was just talking about that. The slogan among nutritionists, among dietitians is often make the right choice, the easy choice. And we of course do the opposite of that. And part of that, as Kim just said, is that the food that's worst for us is the food that's most heavily subsidized. And people will argue as a result that we should get rid of subsidies. But I think that in a way, the correct way to address this is to say, what are we subsidizing? Mm-hmm. Perhaps providing food for our population is not an inexpensive or easy task. It's complex, it's far-reaching. There are a lot of people to be fed. They're all over the place. We're all over the place. And perhaps agriculture, food processing, food distribution, food sales actually do need to be subsidized. But we have a choice. And the question is, what do we subsidize? What is a food system for?
Is there a role here for you know, when you talk about education, food label literacy, sort of a practical skill set that would help people better navigate the challenges of our food supply?
And to add to that, absolutely, education, that's all I do. So Kim Williams, I'm with you. Education is important, but we have to look at education not for knowledge, but for behavior change. And if now the education is on behavior change, the environment must be there, the availability must be there, and the knowledge must be there.
So in that context, Kim, thoughts about food assistance, SNAP? I mean, obviously that just gets at the monetary issue. Is that, do you see that as a big part of the solution in terms of leveling the playing field, a small part? And then Mark, maybe you can weigh in on that as well. And Dina, while they do, you can advance the slide, please.
I really think that it's an opportunity to make things better. That is, we could actually, you know, put together a diet quality, you know, food guideline. I know the USDA and Health and Human Services do that every 5 years, and we could argue about the accuracy of it. But if you just said we're only going to, for example, with the SNAP program, you can't buy cigarettes anymore. There are certain things you can't do. If you make a play for reducing sugar-sweetened beverages, as a great example, where there's a big evidence base behind it, you could really make people change. You can make them think.
If there were one policy initiative that you could see implemented that got it, you know, sort of leveling the playing field, address social justice, and help to improve diets, what's the one thing you would advocate? And then Kim, Mary, I'll ask you the same question.
I mean, if we're in dreamland, I'd advocate for land reform. The U.S. gave away land, and that land is now being used to grow food that for a large percentage of the population is poison. If we're feeding cheap corn and cheap soybeans to animals that we then use to produce cheap, lousy meat, and we're feeding and we're subsidizing corn and soybeans to produce junk food, then we basically are subsidizing a bad diet.
When I look at my you know, the friends growing up in the neighborhood, and you know, the odds of me ending up being, you know, a professor at a major university is pretty small, and the frequency is very, very low. And yet that is very well proven that a graduate degree decreases mortality, cardiovascular mortality. And a lot of it is simple things like food choices, the ability to, you know, to make a priority healthy behaviors. That is something that we do not own in our African American community. So my big initiative, the social initiative, would be to either flip-flop or just equalize the tax-based economics of schooling.
I have to agree with both of them. Education is very, very important, and all these reforms, there is not one strategy that will work. We have to work with several ones in different layers. So as we are looking at education, and not just nutrition education, but education, just here at Texas Tech last year, we did, early this year in spring, we did a study, and those who had at the university-wide, those who had a college degree ate better. And those who had nutrition itself did not predict, having a class in nutrition did not predict a better diet, but it improved their self-efficacy and their motivation. So it was a go-round. We found those who had high self-efficacy and they were motivated also had a class in nutrition. And so both education in general will break all those codes we are talking about, and education and knowledge and the power to act does not know color, and it helps elevate with income level.
You know, what I'm taking away from this is social determinants are important. Social determinants load the gun, but it's nutrition that pulls the trigger.